Hi, everyone, and welcome. My name is Darren Lockaby. I am the president of DESS USA, and we have some really, I hope what you will find is beneficial content for you and educational that will help you in your practices and specifically in your implant procedures. Um, at DESS, we're certainly very proud of the fact that, for over 14 years here in the U.S., we've provided the dental community, dental labs, dental clinicians, DSOs, milling centers, with really value proposition products that provide high quality, which, in today's world is the cost of entry, right? We all care about patient results. We want to elevate patient results, and we certainly do that here at DESS. We provide quality products for you. We do that, with really precision manufacturing. What does that mean for you, the clinician? You get predictable outcomes and reliable outcomes. Again, elevating that patient outcome, and we do all of this really at an affordable price for you, especially in today's market when there's a lot of price compression and really pressure on practices so you use that affordability to increase your profitability, whether that be through gaining a higher percentage of case acceptance or a lower cost of goods, where we can be your partner there, and certainly we hope a valued partner there, especially when we're talking about implants and implant prosthetics. In our story, what we've currently, most recently, in the last 6 months to a year, started looking at how can we provide more value to you, the clinician, the dental lab, the DSO, and we started looking at other ways that are complementary to an implant procedure, other product categories that we could offer to give you a one-stop shop while still providing you, again, high quality products, precisely made, and at an affordable price. One of the categories that we have decided to add, and is currently on our website and available, is biologics. And we have partnered with a global leader in the biologics category in Purgo Dental. We're super excited about this partnership. They share, certainly our philosophy and provide our similar value proposition, that high quality product, precise manufacturing, and at an affordable price. And so we've started this. We're super excited about it. Again, it adds value to you, specifically inside of an implant procedure, whether you're doing a socket preservation for an implant in the future, or you're doing an extraction with immediate placement, and you need to pack some bone around it with a membrane. They have a complete offering, and I'm far from the expert about it on the product, so I have brought in the experts, and it's my pleasure to introduce Brian Sanchez, who is the head of sales and business development for Purgo in the U.S., and Sean Kim, who is the head of operations for Purgo in the U.S. And I will now be quiet and let you learn from the experts, and I'll turn it over to Brian. Brian, it's yours.
Thank you, Darren, for the introduction. Us at Purgo, we're super excited to be partnered with DESS. As Darren mentioned, there's some very similar alignment we have between our two companies and in producing the highest quality products at a good price, and manufacturing process being very, very important to us as well. We don't get the quality of product that we put out into the market without a top-notch manufacturing process. So we are incredibly excited to be aligned with DESS. And what I'd like to present to you today is just a brief company overview, who Purgo Biologics is, kind of where we've come from and to where we are now. And then I will go over the product offerings that we offer through DESS. And I'll go over each one individually. And then we'll talk a little bit about the manufacturing process, and we'll talk a little bit about some bone remodeling and some practice support items as well. But to lead off here, our company was founded in 1999 with a mission to develop safe, high-quality biomaterials for oral bone and soft tissue regeneration. So our headquarters and R&D facility is based in Seoul, South Korea. That's where all of our research and manufacturing takes place. You can see some of the pictures here. We have a top-notch manufacturing facility. I had the chance to go there late last year and see really the steps that we at Purgo take to manufacture the highest quality products. And then in 2025, very recently, we started our Purgo Biologics USA division. And this serves as our North American commercial operation and is headquartered in New York City. So a little bit about the timeline of the company. So we were founded in 1999. And then in 2010 was the establishment of our Purgo R&D Center. And then 2012 started the certification of certain products, obtained the CE marking for our open text membrane, which we'll go over in a little bit. In 2015, obtained the CE marking of the graft. 2017, we see a bunch of registration for various products, OpenTex, the graft material in Canada, the graft material in Russia, products in Japan. So we see a lot of CE markings and things there. In 2018, obtained MD SAP certification, FDA clearance for the graft. 2019, FDA clearance of Biotex, which is our suture. 2023, FDA clearance of the OpenTex and the cover. 2024, FDA clearance of the graft collagen. And then 2025 is our incorporation of our US division. So I like to show the timeline of everything so we can give clinicians let them know that we've been in business for a while. We're not a fly-by-night company where we're here today in the market and then gone tomorrow. You can see we have years and years of history behind us. So we want to be able to instill that confidence in the clinicians for the US market that we're here for the long run, and that we're here to offer the best possible products that we can offer. You can see we have a global influence. So we're in 53 plus countries. We have sales operations in 34 countries. We have 59 plus papers that are published, and 30 papers for SCI Journal, and more to come. We're bringing on KOLs in the US. We're doing things we want to do a lot of things in the US market to build upon what we've done globally. So I just want to be able to communicate that we're an established company globally, but we're just new to the US market. Okay, so we'll focus for the next section on our product offerings that we offer through DESS. We have a pretty nice selection of biomaterials. We offer bone graft materials in a granular form. We offer a bone graft material in a block form. This is the bone graft material and a collagen mixed and put into a block form. We have a couple of membranes. We have the cover in two different types. We have OpenTex, which is our PTFE non-resorbable membrane, in two different types. We have Biotex, which is our PTFE suture, and we also offer collagen guide plugs. So that's the complete product range. And now I'll talk about each one a little bit more in detail. So one of our flagship products is called the graft. And this is a natural porcine-derived bone material matrix for bone regeneration. So it's manufactured through our proprietary process, which is important. And I'll talk a little bit more about that at the end of this presentation when we go over manufacturing process. But just know that we have our own proprietary process that helps put out the best quality, the safest product out in the market. So our proprietary process removes all organic components while preserving the native osseous structure. So, and eliminating immunological risks, sterilized by gamma irradiation and supplied as Cancell's granules in convenient vials. So they come just as shown in that vial in the picture in various volumes. So as I mentioned in the previous slide, it's a porcine-derived bone grafting product. And I think it's important to know why we use porcine. In the US market, we have allografts, we have xenografts, and clinicians choose to use either one based on their preferences. But for those that are using xenografts, the reason why we use porcine is because pigs are much more genetically similar to humans than cows are. So pigs are actually about 90% genetically similar to humans than cows are. And that's important because with the bone grafting product, it allows us to get closer to mimic human bone rather than having a bovine product that doesn't come as close to mimicking human bone as a porcine-derived material. So that is the reason why we use porcine instead of bovine. So our porcine xenograft is safe and biocompatible because of our process that we use. And purity is confirmed by minimal residual protein analysis, so we can confirm that it's safe and biocompatible. Our material has high porosity at the micro, macro, and nano levels. So this is important when we look at our bone grafting material and compared to human bone grafting material and allograft, we see there's a lot of similarities in the porosity of the materials, which is going to be important for fast fluid absorption, cell adhesion, and early remodeling. So the pores play a huge part of that. And the material is gradually resorbed and naturally replaced by newly formed host bone. So that is our graft material in a granular form. Next, we have it's called the graft collagen, and it's a bone block made out of the graft material and collagen. So the graft collagen combines the graft material, the porcine bone mineral matrix, with collagen from porcine tendon. So we're also using porcine with the collagen. And it forms a moldable collagen bone block. The hydrated collagen gives it its viscosity that makes it easier to shape and place than granulars alone. And that's important because when the material is fully hydrated, all right, we get a very nice moldable, trimmable product that clinicians can use in various size defects. So we have excellent hydrophilic properties with high surface energy, which is ideal for absorption of biomaterials necessary for bone regeneration. If you take one of these bone blocks and you were to put it in, let's say, the patient's blood, because of the hydrophilic properties, you'll see the blood start to wick up the sides of the graft of the block. And that's because of the hydrophilic properties. It's really interesting to see, and it has a lot of good properties with it. So the graft collagen stabilizes the clot and promotes revascularization of the grafting material in the defect area. It's easily trimmed and molded to fit various defects. So it's got very, very, very good handling. And it's, like I said, it's easily trimmed and molded. So when it's fully hydrated, you can actually mold it. You can press down on the material and you can see that it has a little bit of give to it, which means you can mold it and shape it to fit different defects that you're dealing with in the patient's mouth. So it does not completely lose its shape when molded before hydration and can easily be applied by molding it to the shape of the defect after hydration. So one of the nice things about it is when you're trimming it and you're trying to mold it, that the block doesn't fall apart. So we have a really nice mix of the graft material and collagen to be able to keep the form of the block, but still be soft enough to mold it. So we've seen other products out in the market that if you try to trim it or cut it or mold it, it basically falls apart. It dissipates and goes back to its pretty much its granular form. So with our material, it doesn't do that. So we supports fast bone formation and predictable clinical results. Able to form sufficient osseous tissue replacement, which leads to minimal chair time. So I think it's important to communicate the mixture of it. Like I said, there's other products out there that have different percentages of bone grafting material and collagen. So we use an 85% graft material to 15% collagen. And we found that gives a really good mix of having enough bone graft material in there and enough collagen in there to hold everything together. And that's why when you trim it, that's why when it's molded, the block doesn't fall apart, doesn't disintegrate. Okay, so that wraps up the graft collagen material. So our next product that we offer with DESS is called the Cover, and this is our resorbable porcine collagen membrane. So the Cover is a resorbable type 1 collagen membrane made from porcine-derived collagen type 1. There's no chemical cross-linking agents that are used. So instead, we use a proprietary self-assembly technology that creates a natural physical cross-link, maximizing biocompatibility. So we get asked all the time, is the membrane cross-linked? So the answer is yes, but we don't use a chemical cross-linking process. We use a physical cross-linking process. So it's available in 2 configurations for different clinical needs. So we have a flexible membrane and we have a stiffer membrane. And they come in various sizes. So the flexible membrane is highly flexible and good tensile strength for irregular defect surfaces and long-term space retention. So it's easy, has easy adaptive handling. So in terms of flexibility and tensile strength, when the membrane is fully hydrated, you can actually kind of pull on it and it becomes flexible to naturally lay over ridges, over defects easily. So when you need to suture around it, it's not coming up on the sides. It's not too rigid. It has a really good combination of flexibility, but still able to keep tensile strength. So for the Cover Flex, it is 0.3 millimeters thick and comes in a 15 by 20 or a 25 by 30 or a 30 by 40 offering. All right, and then we have the Cover Stiff, which is strong resistance to biodegradation. So it's ideal where longer bone maturation time is needed. It's hydrophilic, so it maintains its shape for 3 or more minutes after hydration at room temperature and is thicker than the Flex. It's 0.5 millimeters thick. And there's a reason why why there's two different thicknesses. So the cover flex resorption period is around 3 to 4 months because it's 0.3 millimeters, and the cover stiff, which is the 0.5 millimeter, is a 5 to 6 month resorption period. Okay, and then we do have another membrane offering, which is called OpenText, and this is a non-resorbable medical grade PTFE membrane. So OpenText is a non-resorbable microporous PTFE membrane. It's not a collagen product, being PTFE. So it acts as a physical barrier to block gingival cell invasion, creating the space needed for bone-derived cells and new blood vessels to regenerate the defect. So stiff enough to prevent collapse, yet gentle enough to conform to tissue contours. So we have two different versions of the OpenText available with DESS. We have the non-textured version, and we have a textured version. So both are 100% medical grade PTFE and are safe from chemical and biologic reactions. So for the textured version, has microporous designs to promote gingival attachment and fluid circulation. But it prevents fibroblasts and bacterial penetration. Minimally invasive, and primary closure is not required. And they can remain exposed and still protect the regeneration site. So the important thing is you don't need primary closure when using the OpenText product, and you can use the textured version if you need to suture the actual membrane. Okay, and then the next product we're offering with DESS is called Guide Plug, and this is a collagen wound dressing. So the Guide Plug is a white, porous, pliable, and fully absorbable collagen wound dressing made from highly purified type 1 collagen extracted from bovine tendon. So unlike our other products that have collagen that are derived from porcine, this particular product is derived from bovine. It's easy to apply and designed to protect the wound bed immediately post-extraction. So the Guide Plug, it's a highly porous sponge structure that absorbs blood and promotes socket healing. You can see the pictures on the left-hand side. The top one on the left, you can see it looks like a soft bullet. And it's easy to cut, so depending on the size and the shape of the defect or the extraction socket, the clinician can cut and trim it to fit the size as needed. So it stabilizes the blood clot and facilitates new granulation tissue formation. They come sterile, so they come in a box of 10, and they are sterile for single use only. Each Guide Plug is packaged individual and sterile. So you can open up the box and just take out the Guide Plug that's needed, and then close the box back up. The degradation time is about 4 weeks. So our final product offering is called BioText, and this is our non-resorbable PTFE suture. So BioText is a non-resorbable 100% PTFE monofilament suture with a stainless steel surgical needle. So it's uncoated, it's undyed, and designed specifically for oral surgical procedures where clean, bacteria-resistant closure is critical. So So the biotext is, so it's non-wicking, so it eliminates bacterial migration along the suture track. It's highly pliable, so it's easy to tie and reposition with minimal unintended loosening. So it's basically easy to tie and hard to untie. And the slim reverse has a slim reverse cutting needle. And that's important. So if you look at the picture on the bottom left that has the two triangles, you'll see on the left that says biotext, the cutting, the needle actually tapers at the end to minimize the surface area. So it cuts through the tissue very, very easily. And that's important because it will have less tissue trauma and a smaller penetration area. So the patient afterwards isn't complaining of soreness just from the sutures. And that's feedback that we get from the clinicians that are using biotext. That's one of the things that they like the most. It has a strong needle attachment and high needle rigidity. It's reliable performance under suturing stress, and it has no package memory. So when the sutures are pulled out, the threads are not twisted or clumped together, but spread, making them easy to use. So also in the picture there, the picture with the suture packaging out of the box, you can see there looks like a little racetrack around the outside of the packaging. And that is where the actual suture material is wound. So when you get your needle holders and you put them on the needle and you pull out the suture material, it doesn't coil up on itself. We see it all the time with other sutures that has a lot of memory. So when it's packaged in there for a while, right, it maintains the memory of the packaging. So one of the best things about the Biotech suture is it doesn't do that. So when you pull it out, it lays straight. So it's easier. It's not going to get caught up on tissue or adjacent teeth. It's straight. So when you're suturing through the tissue, it pulls through much easier. And that's also some feedback we get from clinicians who are using Biotex and like Biotex. That's one of the things that they talk about a lot, is that when it's out of the packaging, it doesn't have that memory to it. Okay, so that's it for our product offerings that we have with DESS. I think it's important to talk about our manufacturing process because we do things just a little bit differently than some of the market out there. So I think it's important to talk about kind of how and why we do what we do. So every product in our portfolio, from our grafts to our membranes, is fully designed, processed, and quality controlled in-house by us. So the importance of it means we have complete traceability and consistency at every step. We go through a very rigorous quality control process and a very rigorous manufacturing process to be able to put out the highest quality products that we can. So as mentioned in that slide, when we introduced the graft product, we talked about a proprietary process. Can't go into great detail about it, but some of the detail is, so we use a lower temperature over a longer time to process the materials. So the reason why we do that, it preserves the natural collagen structure and bone protein integrity of the material. And it maintains the native osseous structure, supporting better biological integration. And virus inactivation process ensures the highest level of product safety. So in the market today, we see other products that have a high heat, fast processing time. It's pretty common in the industry, but that can damage the collagen and reduce bioactivity, which is what we're taking painstaking steps to mitigate those risks of damaging collagen and reducing bioactivity. That's why we use a lower temperature, but a longer processing time. And that gives us the quality of the product that we have with the graft material. And in-house collagen extraction. So we extract and process our own collagen internally. So this ensures purity, consistency, and full supply chain control. So the graft collagen, as we mentioned before, is sourced from porcine tendon, and we process that collagen that we use in the products in-house. So we have stations in our manufacturing facility that is basically their job. They do it all day long, is they process the collagen. So because of our process, I think it's important to talk a little bit about bone remodeling, and kind of some of the results that we can get because of our processes. So understanding bone remodeling helps clinicians set the right expectations with their patients and choose the right product for each clinical case. So we have 3 phases. So osteoconduction is one. So it serves as the scaffold for new bone cell migration and attachment. Vascularization. So collagen integration promotes early blood vessel ingrowth into the graft site. And remodeling. So gradually resorbs as host bone replaces it, resulting in natural, fully integrated bone. So our process supports better remodeling. So as mentioned in the previous slide, low heat manufacturing preserves the organic protein matrix of the bone. Retained protein matrix plays a pivotal role in facilitating the biological cascade mentioned above. And as we mentioned in the previous slides, the high porosity, right, the macro, the micro, and the nano porosity in the graft ensures rapid fluid absorption and early cell adhesion. So also mentioned that the micro, macro, and nano porosity of our material being derived from porcine mimics closer to human bone rather than using a graft material that's derived from bovine. So our materials, its predictable resorption profile supports implant placement timelines. So we can ensure the highest quality product, which means you have better, as a clinician, better predictability with the timeline for placing implants. So you're going to get consistent results time after time after time. So practice support. So one of the things that we want, we're a biologics company, but we also want to partner with people like DESS to be able to provide practice support for clinical offices. So we believe that a great product is only part of the equation, right? So we want to help your team confidently present and recommend socket preservation to every eligible patient. It's just as important as their clinical outcome itself. So we want to help, the clinicians that use our product to recommend socket preservation at every possible opportunity. So why is that important? So increasing socket preservation patient awareness. So we're actively developing dedicated chairside support materials to help dental offices educate patients on the importance of socket preservation at the time of extraction. So when you're presenting cases to the patient, we want to be able to help provide materials to be able to help communicate with the patient on their level. And the materials are going to be designed to be simple, visual, and easy to use and easy for the patient to understand. So any team member can walk a patient through the conversation with confidence. And our goal here is to make socket preservation a standard part of every extraction conversation not just an afterthought. So when you're presenting cases to the patient, you can confidently, in an easy, simple way, communicate the importance of socket preservation for the patient, and then be able to offer that to all of your patients. That's an important thing that we want to be able to provide for clinicians. And we also want to create training for doctors and office staff. So we are in the process of developing a training program for both doctors and front office and clinical staff. So we want to be able to cover the clinical basics on how to identify the right patients, how to present socket preservation as a long-term benefit to the patient's oral health and implant success. So it's an all-in approach. And staff-specific guidance will help teams handle patient questions, objections, and insurance conversations at chairside. Whether you're presenting this to your patient or your staff is presenting it to the patient, we want to be able to have a consistent message that can be communicated to the patient across all levels of the practice. And all chairside material and training will be released soon. And when we do, DESS will be the first partner that we roll this out to. So they'll be the first to receive access to these practice support materials. And with that, I would like to thank you for your time and for your attention. I encourage you to scan these QR codes, follow us on social media sites, and stay tuned for more information. So we've just opened up our operations in the U.S., so we'll be putting out more information into the market about products and product offerings and anything that we're doing with our partners.
First, thank Brian and Sean for taking time out to come share with our audience. I want to thank our customers for continuing to trust us. Again, we're excited about adding Purgo. Their breadth of offering gives you options, and that's something you need as a clinician. But more than that, their products are easy to use. So that's saving you time. It's saving you money. It's allowing you to utilize our products for whatever type of indication you had. We're really ultimately happy to welcome them to the DESS family here, and new to the U.S. market. I am confident they will grow. We're happy to be one of their partners to hopefully contribute to some of that growth. And I'll tell Brian, dude, you had me at Protein Matrix. I was smitten at that point. I was done the rest of the time. I will tell a short story. To those that are tuning in and listening. Many years ago, another lifetime ago, I was working with a DSO, and they were 600 plus at the time, office DSO. And we were doing an audit, and they found out they were only doing, Brian mentioned it, you do a socket preservation for every extraction. At that time, this DSO was only doing socket preservations on 10% of their extractions. And we worked with them on, an educational program, and helped get that DSO within 12 months up to 60% of their extractions going to socket preservation. Now think about that, whether you're a solo practitioner and you think about it for your one office or your two offices, or you're a large DSO with 1,000 dental offices. It doesn't really matter. Think 10% to 60%. First, think about how better off your patient is. It's a better patient experience, and it really it's a better patient outcome, because that patient, okay, so they may not be in a position to get an implant now. Maybe they're a 15-year-old female that hasn't finished growing, or maybe financially, they're not in a position to get an implant. You do the socket preservation, better for the patient. certainly long term, they may be in a position to where they want to do something more later that is even better treatment modality. Second, from your practice standpoint, think of the immediate revenue by just adding a socket preservation to an extraction. Again, revenue is not what we're striving for, but if you're giving the patient a really good outcome and you can make more money, why? And it's not significantly more. Like a socket preservation does not cost that much more. You guys know this. And then the potential for the future. So when you've done that socket preservation, 5 years from now, the patient gets an inheritance or hits the lottery or whatever the case may be, their financial situation changes, and now they can come get an implant. They're going to come to you because they now trust you to do what's best for them, and you can do it quicker, less, impactful to them. It's an easier procedure. So this is something I personally believe in. I know the Purgo team believes in. We're super excited about the partnership. Now, we want to sell it to you. We want to get it in your hands. So Julie, how do we do that?
All right, so you'll just go to our website, which is DESS-USA.com. You can find Purgo products under the products tab, and then you'll go right down here to biologics. And then you can see the full products listed out here. And then we also have it listed by each category up here. So that's how you can purchase Purgo.